So super, super important. Now, what happens in chiropractic, oftentimes we'll find that people are either misaligned, okay, or pinched in some way. And so the nerve in here, or the nerve root, or the nerve rootlet can be also compromised, compressed, impinged, or irritated, okay, when that occurs. There are some extreme cases where it even occurs like that, okay? But typically people are either this way or that way or rotated in some way, okay? So what we're fixing in chiropractic is we're figuring out what level this is happening going in, and we're trying to realign the body so that this nerve becomes free, okay? Because that's what you want. You want to free the nerve in that way. So now, in order to achieve that, there are things we need to do. So for example, most chiropractors address this issue, but sometimes it's hard to get in there because there is the issue of muscle spasm, and the muscles overlay the spine like that, all the way along the entire spine. Okay, so there are various techniques that we would use as chiropractors. There's various techniques that acupuncturists will use in order to relieve that muscle spasm or that muscle stress. Okay, so what I do, what I'm certified in, is Graston technique, and that's where we go in, we will strip the muscles that are over top of this area in order to force them to relax. Okay, because there are people who are chronically tight, chronically spasmed, just real stiff all the time, and you won't be able to relieve this nerve impingement unless you alleviate the muscle spasm first. And that's using chiropractic. I would use soft tissue mobilization via Graston technique.
Yeah, just piggybacking off of what Dr. Oduwole said, using a combination of both acupuncture and chiropractic, it's really a powerful combination, or a powerful medicine, mainly because the chiropractic can, like Dr. O or Dr. Oduwole mentioned, if something is off, it can create that adjustment to get things back into place, where the acupuncture, if you can imagine these blue gloves as muscles, right around our spine, there's muscles all over. That's really what holds your spine together. And with acupuncture, we can kind of get in, if the person's laying down, we can get in with an acupuncture needle into these muscles in and around the spine and create a release. Because if these muscles are very tight due to a spasm or due to injury or whatever it may be, it's going to create that compression, right? They're going to be very tight and create that compression, which can lead to an unhealthy spine like maybe you see here, that or old age. So with the adjustment, getting these joints to kind of adjust, creating more room, with the acupuncture getting in there and releasing the muscle, creating more room, gives you, the patient, more relief and less pain.